So basically, I was able to find a couple of animations that would detail the types of procedures that I had to go through. Now, they're not exactly the procedures that I went, well, the procedures are the same, just the parts of the leg um, that the pen was gone through, and the animation they went through the femur, and mine went through the tibia. Um, but it gives you a great idea of the procedure itself. Um, all of the exact parts of the procedure are in there. I've even overlaid some of my x-rays with some of the footage, and the external fixator part on the second animation is a little different than the fixator that I ultimately ended up with, but it gives you a great idea of the work that went into trying to repair my heavily destroyed leg. So, um, my fractures were terribly severe, um, approximately 3 or so inches above the ankle joint, the tibia, which is the thick shin bone, and the fibula, which is the smaller bone from the knee to the foot, making up the ankle joint. Those two leg bones, um, one on either side, create kind of an upside down cradle that the bones of the foot rotate in and out of. It's called a pylon fracture when you break both of those bones. Pretty much the same injury that Tim Krumrie, the nose tackle for the Cincinnati Bengals, suffered in the first few minutes of the 49ers Bengals Super Bowl in the 89. I'm from Cincinnati, so dear to my heart. A lot of people in Cincinnati would say that almost directly resulted in the Bengals losing that game. But anyway, in my case, the bones were fragmented so bad that all the doctors agreed that they were beyond typical repair. Usually they would screw titanium rods and plates along sides of the bones to hold them together so they could heal themselves. I had nothing to screw to. The ankle itself on the foot side was perfectly fine. Tendons, ligaments, none of those were damaged. However, everything about 3 to 4 inches and down was totally destroyed, and enough that the splinters created they almost acted like shrapnel, slicing through the blood vessels, giving fracture blisters, which are only apparent in less than 4% of these kind of fractures. And basically what happens is the bones are so fragmented and they're splintered so small and so abundantly that they just shred through the muscle and the blood vessels, and they create huge pockets of blood. Mine was up both sides of my legs, and it stays inside of the skin like a blood blister, and there's a serious risk of infection. And the agony was like somebody was taking a cheese grater or sand paper and just running up both sides of my leg. Needless to say, most of those fragments had to be removed, in turn leaving the leg 2 inches shorter than before. They had to actually cut the shin bone flush off, so that way it just kind of abruptly ended, almost like if you take if you take your fist and you open it up and you have fingers on one side and your thumb on the other, that would be the cradle. But if you close it and make a fist and your arm bone coming down, that would be like the shin bone coming down, and your fist would be the abrupt stoppage after they cut off the cradle. So the solution was, once the shrapnel was out of the way, they take the pieces of the fibula and use it as bone grafts to encourage new bone growth and permanently fuse the shin bone to the foot. I would never be able to wiggle my foot again, but I would be able to walk with a limp, and that's the best way to reduce chronic pain and early onset arthritis, which I'm most definitely going to have. So what do you do when you take off 2 inches of the bottom of the leg? You have to lengthen it back. How do you do that? That's when you take these screws. If you see in the picture right there on the right, looks like there's some cylinders that are a little bit bigger than the rest of them. Those rest on big screws, and you turn those every day. And you lengthen it back by you turning them 3 times a day. They do about a third of a millimeter each turn. And when you break the leg again in a solid spot just below the knee, and that gives you the area that you are going to stretch from. So you'll have a ring around the knee, which is what you see right there. Then you'll have a ring about 8 or 10 inches below that, and the spacers are in between that, and you turn those cranks every day. The flesh, skin, muscle, tissue, tendons, ligaments, everything, those have to get back to the original length. How is that possible? Well, it's possible by turning those cranks, but in order to not cause enough damage, you have to do it slowly enough because the nerves in the leg can regenerate about a millimeter a day, coming out to about an inch a month. So you have to stretch your leg every day for 2 months. And yeah, I said that right. You yourself have to do it. Turning those screws, they move a third of a millimeter increments. You're responsible for turning them 3 times a day, every day for 2 months. I know what you're thinking, but skin and flesh can only stretch so far before it tears, and you're right. And I have the scars to prove it. I have these little track marks. The process itself is absolutely amazing, though. It all works as if it works as prescribed. It takes constant monitoring, though. X-rays every week at first, make adjustments every 2 weeks eventually, and then eventually once a month. And incredibly, if it all goes as planned, as long as you can endure the constant pressure, excessive swelling, and keep from falling on it. And if you know me, I took 3 pretty nasty spills. I couldn't keep from falling on it. But they definitely made the process longer, but you're so secure with all those rods and pins and wires going through your leg in all those different areas. 6 wires through your foot alone, that's 12 protrusions. And those things are constantly open too to the environment. You have open wounds on your leg constantly this whole process. Everywhere where you have a wire or a rod going through your leg, you have to clean those areas. Those are open wounds constantly, and every time you clean them, you're breaking open the scab and exposing fresh flesh, and it's a painful process. Um, but it made the process a little bit longer with me having a couple of falls, but it it definitely didn't have anything to do with why the bone graft wasn't successful. That happens sometimes, even when it's your own bone that you're doing the bone graft with. It happens more often when people use cadavers for the bone graft, but it happens even when you're using your own bone. Your body rejects it, or it just doesn't take root very well. Um, but if you remember, initially the process wasn't even an option because they said there was nothing to screw to in the beginning, until they got all the fragments out of there and they made a clean break at the bottom of the shin. And then they just left the fibula just hanging there. You use those pieces of the fibula to make those bone grafts. And the fibula is just dangling loose in your leg for the rest of your life. But due to the ability to lengthen the tibia, they were able to run a titanium shaft through, all the way down through into my ankle. In this picture here, you can see those fracture blisters, and they just turn into huge scabs on the side of each side of your leg, and it's a pretty nasty process. I have to admit, it's one of the most difficult things I've ever been through. 8, working on 9 months right now. This September 12th will be 10 months. And there's serious concern for infection setting in, and your lower extremities heal 3 to 4 times slower than the rest of your body because the blood flow can just pool from gravity. And being sedentary doesn't help because it's the contraction of your muscles when you walk that, pushes the blood back up through your heart and through your system. If I were a horse, they would have took me out back and shot me. But luckily I live in Cincinnati, and that wasn't a concern. So you see that I'm in this walking boot now, and Cincinnati doctors come from all over the world to learn here and to do the residency here. The Air Force and the Navy even have active duty surgeons that they send here to get training because we have one of the best trauma units in the city, in the country. So still have a long road, and I'll try to keep people posted, but I thought maybe this video would be kind of fun for people to get caught up, because I've been a hermit for the last 8 months, and hopefully everything will work out. But I'm definitely starting to see the light at the end of the tunnel, for the first time in a long time. But they actually got the bone set, so smooth sailing from here. Like and subscribe. 3D Third Eye.